And speaking for the three of us, we really rely on you all to kind of have your finger on the pulse of what life is like out in some of our more outlying communities, and really appreciate what you all bring to our discussion of how we keep making Missoula County better for everyone. So, and tonight we have a handful of our staff, including Cindy Farr, which is a new one for tonight, who will be able to answer all kinds of COVID-related questions, which I imagine you all have. And Cindy's been working a pretty insane schedule since this whole thing started, so we really have to offer our appreciation to her to work even more extra hours to join us. So if I remember right, Sarah, were you just going to move through our list and people would ask questions?
So first, I thought Cindy could give an update with what's going on with COVID-related topics.
Oh, great.
And then let people ask her questions.
Fantastic.
And Shane's staff to do a public works update, and then have folks ask him public works related questions.
Good. All right. Thank you so much. Then I'm going to mute myself and listen in. All right, Cindy, please take it away.
Hi, everybody. So I'm Cindy Farr. I work at the health department. I've been working here for about 12 years, and my role here when I am not running incidents is I am the health promotion division director, which means that I supervise about 17 public health programs. And the two of the programs that put me in the position that I'm in now are infectious disease and public health emergency preparedness. So anytime that we have a emergency such as that is public health related, then I'm pretty directly involved. Also, anytime that we've had any outbreaks in the past decade, I've been pretty directly involved in that as well. So that's how I ended up as the incident commander for the COVID pandemic. So currently, as you all know, we did move into phase 2 of reopening on June 1st, and exactly one incubation period later, we got our first COVID case of our new spike. We are seeing cases coming in every single day at this point. We had 5 that were new as of this morning, and we got another 2 that I know of at the end of the day today. So we're definitely seeing them coming in at a pretty good clip. It's keeping us pretty busy here at the health department, because what we do is the contact tracing and monitoring and putting people into quarantine who have become contacts to a case. A lot of the cases that we've been seeing have been travel related, but we have had some that have been community spread, which basically means that we know that the person did not travel anywhere, and we also know that they are not a contact to an already identified case of COVID-19. So we've definitely, we are starting to see that community spread again here in Missoula County. We have not had any hospitalizations with this new spike that we are seeing so far. It has been in younger, healthier people, which is a good thing, because one of the things that we are trying to do is protect our healthcare hub here in Missoula with our hospitals and our clinics, as well as we want to protect the people that are the most vulnerable to bad outcomes from this disease. So while we are seeing a big increase in cases, so far, knock on wood, they have been younger and healthier individuals. At this time, we have been asked by a lot of people if we are going to start requiring people wear masks in public because of the fact that we're seeing so many more cases now, and that is on the table for discussion, but we have not made any decision in that way yet. We are starting to see some of our neighboring states are making it a statewide mandate, and I believe there's about 6 or 8 states now in the United States that are mandating mask wearing in public. So it's on the table for discussion, but we have not made any decisions to that yet, simply because enforcement is impossible. I mean, we're not gonna be able to tackle somebody on the street and slap a mask on their face. So it's kind of one of those things, like if we make it a mandate, then there's a certain level of enforcement that is expected by the community, and we just haven't figured out how we could enforce that. So We have also had a lot of questions about what's going to happen and would we be stepping back in phases at any given time and what those triggers might be. And so I thought I'd talk a little bit about that here. Basically, what we have to look at are a few different things. We have to look at, like I said, our capacity for being able to do the case investigation and contact tracing here at the health department. We're currently understaffed because when the hospitals and surgery centers opened back up for elective procedures, a lot of the nursing staff that we were able to get earlier in the pandemic went back to their previous jobs. And so we are looking for nurses, LPNs, schedulers, call takers for our call center. So if you guys know any people that are interested in working for the health department, we would encourage them to reach out. They can call 258-INFO and get directed to the right person. They are primarily full-time jobs. So I just want to put that plug out there because we are having a difficult time maintaining good staffing levels. A lot of people don't like to work in the summer. This is a time when we like to get out and enjoy the beautiful state that we live in and our beautiful county. And so it's always historically been really hard to recruit in the summertime. It's just really hard to recruit right now. So that is one of the things that we have to look at is our capacity to continue contact tracing and monitoring for our contacts. We currently have about 123 contacts that have been identified at this very moment in time, but I've got several cases that are still in the early stages of case investigation, so I expect that number will go up. So the other thing that we look at whenever we're trying to determine if we need to step back is our healthcare resources. So we need to know that not only people who normally need to access healthcare resources for normal medical care, but also car accidents are going to continue to happen. People are going to continue to have, cardiac arrest. People are going to continue to have strokes. And we also want to make sure that people who do get sick enough to need treatment for COVID-19 that we have the capacity to treat them. We don't want to have unnecessary loss of life because our healthcare hub is being overrun. So that is something that we keep an eye on. I have access to a program called Juvari, where I can look every day and see how many hospital beds do we have available out of the total number of hospital beds that are out there in our community, as well as things like personal protective equipment for our healthcare providers, looking at how many ventilators we have available. And so we keep a really close eye on that so that if it starts looking like it's taxing our healthcare infrastructure, then we're going to have to put some more requirements and restrictions into place so that we can keep them able to treat people who need treatment. The other thing that we have to look at is our testing capacity. As you all recall, early in the pandemic, basically nobody could get tested. And then once we were able to get some people tested, it was only if you lived in if you were a high risk group person and you were having symptoms, and they had to be very specific, only 3 of the now 9 symptoms of COVID-19. That's not the case anymore. Now we do have adequate testing capability in our county. We are now starting to implement some asymptomatic testing. So people who are in high risk work areas, because we're a high visitation county where we get a lot of tourists that come through, we're starting to do some asymptomatic testing of people who work in healthcare, people who are working in the grocery stores and the gas stations and the restaurants that are taking care of not only our own community that is going to those places, but also the people that are coming in from out of town and out of state. We are hearing anecdotally about a lot of people moving to Montana because we are the safest place to be right now. We have had the lowest incidence, number of cases per 100,000 population for a while. And so that's been, in addition to all of the other wonderful reasons that we live in Montana, that's now become a draw for people to move here or come here for extended vacations. So those are the things that we have to look at as we move forward. We want businesses to be able to be open, but we also have to make sure that, we can manage this outbreak as it moves forward. We have gotten a lot of people asking questions about antibody testing, so I'll touch on that a little bit. The testing that we do through our drive-through testing facility, our mobile testing clinics that are now going to Frenchtown, Lolo, Sealy Lake, and Clinton, and a lot of the healthcare facilities that are using for diagnostic testing is what's called a PCR test. And so it's a swab in your nose and you're looking for viral particles that get picked up on the test. Antibody testing is different than that. That's basically doing a test to draw your blood to see if you've developed antibodies that would be indicative that you may have had the disease already and either had it and were asymptomatic, or that you had it and your symptoms were so mild that you didn't know, or you got really sick whenever you you were not able to get tested and you think you might have had COVID, then that's what an antibody test would be used for. There's a lot of problems with the antibody tests that are on the market right now. So some of those problems are that they're not reliable. They basically, the ones that are on the market can test for coronaviruses, but it could be any one of 4 to 5, depending on the brand of test, coronaviruses, some of them including the common cold. So it doesn't really help you to know that you had the common cold when we really want to know if you had COVID-19. So that's a huge limitation to the antibody testing. There's not any that I know of that are fully FDA approved at this point, but there are a lot that have been given emergency use authorization so that they can collect data on how accurate those tests actually are. So once we have an accurate antibody test, we will definitely be looking at that avenue of testing, but right now it's just not accurate enough for us to be able to do anything with it. So so that's the sort of short download of what we've got going on here in Missoula County for COVID-19, and I would like to open it up for questions. And I don't know how you guys want to do the questions, if you want people to push their little raise my hand, or if you want to just let people call it out. So whoever wants to run this part of the meeting, I'm going to let you figure that part out.
We can go down the list like we usually do, if that works for everyone.
Yep.
So, Bert, you're first up.
The only question I've got is, can we vote on making masks mandatory?
We have had discussion about making masks mandatory, and I know that initially the Board of Health really wanted to go that direction, but then when we started trying to figure out how would you enforce that, then that's where we got hung up on it. And now that other states are making it mandatory, I have been told that our governor does not have any interest in making masks mandatory, but of course, the governor says something to us one day and then says something completely different publicly the next. So we're not really sure what he's going to do. So as far as like a statewide mandate, I don't know if that's going to come down. I actually do have a meeting on my calendar with the health officer tomorrow to discuss it, because we have had a lot of people requesting that we do it. And I just want to revisit the conversation again and see if we feel that that's something viable or not. So we're discussing it, but at this time, there's no for sure plan to mandate that.
Okay, just asking. It seems like it works well at Costco when they, if you're not wearing a mask, they hand you one to go in the building. So seems like there would be an enforcement there. But
yeah, and we have also actually, I just did a presentation with the Missoula Economic Partnership, and talked about this as well with the business owners that were on that meeting, and that was about 2 days ago. And there were quite a few people that attended that meeting, and I encouraged them that, you know, while we are not making it mandatory from the health department level at this time, you know, that we are discussing it, but private businesses are welcome to make it mandatory. And, you know, some businesses are, and they don't seem to be having any trouble with it, as long as if a person shows up and they don't have one, that they're able to provide them with one. So we have been encouraging that with the businesses. Of course, some are going to do it and some aren't. So that might be, you know, one thing that we tell the public whenever they're complaining is, you know, search out which businesses are going to make it mandatory if that's what makes you feel safer going into those businesses, because that sends a message, right?
Yeah,
So-
my last comment is there was a store I saw in Kalispell. It was on the news and it had a sign on the door that says, "I don't know where you've been, so wear a mask."
Yep.
Awesome.
I'm done.
Thanks, Bert. Next, we have Devin.
Uh,
Devin, do you have any questions?
Yeah, really, the only question I have, other than Bert's mask comment, would be how are we handling interstate travel? I'm seeing a lot of license plates from Texas the last couple days. I saw Georgia and Florida when I was up in Ronan last week. So obviously, there's a lot of traffic coming into the state, but it's not coming through an airport or a traditional port. How are we handling that?
Yeah, so basically, when the governor removed the 14-day quarantine for out-of-state travelers on June 1st, we saw a huge uptick in travelers coming to, to Missoula and Montana in general. There's not anything that we can legally do about that at this point. So the only thing that we can do is to continue to warn people who live here that you need to be very careful about who you're interacting with, because when those out-of-state travelers are coming, there's always a chance that they're bringing COVID-19 with them. And so, doing all of the things that you can do to protect yourself is what's important, because we can't keep them out. But we can say, protect yourself, only go out in public when you need to, try not to interact with the tourist areas, because we're definitely going to see it, and we just can't, we can't close the interstates. So.
Next, we have Doug Emerson and Seeley. Or Devin, were you done?
No questions here. That was very informative, though. Thanks.
Thanks, Doug. Jennifer and Lolo.
Hi, we had our last meeting and it was in person, and we hadn't done that for a long time. I was super disturbed because we had set it up to have 6 feet apart between every chair. But then we had members of Lolo come in and they moved chairs back together and kind of ridiculed people for wearing masks. And I felt that was, it's tough as someone who wears my mask like faithfully. Just wondered what recommendations you might have going, if we can say in-person meetings are done for now, or if you have any recommendations of what rights we might have to say to attendees regarding such like that.
Yeah, so my recommendation from the public health side is that if it's possible to be done virtually, it probably needs to continue to be done virtually. That would be my recommendation, cool. Because I am very worried about the spike in cases that we're seeing, and the more we get people together face to face, the more possible it is to transmit the disease. So, we've all gotten pretty used to having to have these kinds of virtual meetings. And while we may not like it, I mean, I miss seeing my coworkers. I miss seeing my friends. So we may not like it, but it might just be something that we need to live with for a while. But as far as like public meetings, I'd have to defer that to the commissioners because I don't know what rules you guys have on that stuff.
Well, this is Dave, and I would say you should feel free to take your cues from the commission, and we are not having public meetings in person at this time. And I think our plan, correct me if I'm wrong, anyone out there, is we're probably going to be in this virtual mode at least through the month of July and then reassess. So you can always say that is how the county is conducting its business right now. And I would, the sort of scene that you painted there at your last meeting is a little disconcerting.
So Commissioner Strohmeyer, Chris Lonsberry, and that is correct. At least through the end of July, we are beginning to have conversations about how we can potentially have hybrid meetings because of concerns over public access, but none of those decisions have been made, and at least through July, we'll still be virtual.
Thanks, Chris. Jennifer, did you have any more questions?
I'll do it. Thanks.
Jerry Dallas in West Valley.
No, I don't have any questions.
Okay.
Hey, Sarah.
Yep.
Sarah, this is Josh. I'm sorry I was muted and was talking away. I just wanted to throw something out. That the United Way right now is working with MEP and some other partners on a publicity campaign to really push the wearing of masks and stay 6 feet apart and the whole bit. And hopefully that might put a dent in the kind of behavior that was referred to in Lolo. So I'd hope in the next 2 weeks we start seeing a big push publicly that we need to behave this way. Otherwise, the numbers will keep going up. And if the numbers go up, we'll have to retrench, which no one wants to do. So look for that in the next couple of weeks, and hopefully that'll make a dent in people's behavior.
I hope so.
Thanks.
Callie and Bonner, do you have any comments?
Yeah, I have a question. So Cindy, thank you so much for your report. That was really helpful. You mentioned the conversations around requiring masks, and you also started talking about triggers that would make us start talking about reverting backward phase-wise. And I don't know if I missed it or just didn't get quite a clear picture of, would you repeat what you said about what you're talking about regarding going back to phase 1 or a different, taking other precautions right now?
Yeah, so the three main things that we look at in public health when we're looking at how we can best protect the public and at what point we might need to take even a half step back. I mean, we opened slower than other counties, and part of the reason that we did that was so that we didn't have to go straight from, okay, we're totally open and now we're just shutting right back down. We tried to put some half steps in there so that if we need to take a half step back, maybe we have somewhere to go back to without having to go back to the full closure. And so the three things that we look at is our testing capacity in our county, our ability to do contact investigation and quarantine and isolation for the people that are either identified as a case or as a contact, and being able to protect our healthcare infrastructure so that we know that the hospital is able to treat people that need to be treated. And one of those half steps back that we would consider is, we start seeing that the hospital is starting to get really full and we're seeing more and more cases, then maybe we tell the hospital systems that they need to stop doing elective procedures again. And that, that way we're protecting that healthcare hub. So it's not an all or nothing kind of situation. It's more of, it's a really fluid situation, and we have a lot of factors that we really need to look at. And we do have a lot of options of things that we can do to take those half steps back so that we don't have to hopefully go back to a full closure. Not that that would be completely off the table. I mean, if suddenly tomorrow we woke up and we had 100 cases, which I'm not saying this to scare anybody, but this week we have been testing more symptomatic people than we have this entire pandemic. I think we saw 88 people yesterday. So it's not unheard of that we could potentially wake up and have 100 new cases. If we wake up with 100 new cases, we're going to have to shut things down. I mean, there's just like no two ways about that. But what we're hoping is if we keep seeing this coming in gradually and we're not seeing a ton of cases all at the same time, that if we do need to take some measures to protect different sectors of that, whether it's the testing or the healthcare infrastructure, or our ability to do contact investigation and tracing, that we have steps that we can take back to get us in a position where we can better control it. Does that help answer your question?
Yeah, that was really helpful. Thank you so much.
Yeah.
Hey, Cindy, this is Juanita. I'm sorry, just to follow up on that. What's the threshold for, you said the contact tracing crews are stretched pretty thin right now. What's the threshold there?
We don't have a set defined threshold. I've got multiple different teams here at the health department, teams of nurses that, some of them only do the monitoring of people who are in quarantine, which we do have an app that we use to help with that triggers people to check their temperature, check themselves for symptoms, get in touch with us. If, it actually alerts us if they put in that they started having a symptom, so that it helps reduce the workload, because we do have to check in with those people who are in quarantine twice a day. And so if you can imagine, we've got 125 people in quarantine right now, roughly. And if we have a nurse that has to call them twice a day, that's quite a lot of nursing capacity that we need for that. So we do have the monitoring app that is what we're using to help with that. Then we've got our case investigation nurses, and they are solely responsible for doing the interview with the case whenever they come in, to try to determine who the contacts are. And then we've got our contact investigation crew, and they're the ones that are contact tracing, that reach out to those contacts and assess whether or not they have symptoms, and if we need to get them in for a test. And then also, like, okay, who else might have been exposed. So I've got multiple different crews that work on this. In addition to, I have a whole nother set of nurses that their only job is to make sure we don't have another outbreak on top of this one. So they do all of our normal infectious disease work, because things like chlamydia don't stop coming in just because we're in a pandemic. And waterborne illness, foodborne illness, I mean, we still have to keep an eye on those kinds of things. And so really, when we get to a point where it looks like our nurses that are dealing with COVID are stretched to a point where if we get one more case, it's going to be a couple of days before we can even make the initial contact, then we're going to have to take some steps back. But that's why we're really actively and heavily trying to advertise that we're recruiting for nurses, because as we're seeing our cases increase and our contacts increase, we need more nursing capacity. So yeah, if y'all know any nurses that would like to have a job, send them our way.
Thanks.
Thanks, Cindy. Kevin and Lolo, do you have any questions?
Yeah, let me get unmuted and get my camera on. I do have a couple questions. Cindy, thank you for being here tonight. It's nice to have some interaction with you. A question for you regarding masks. I come from a mold remediation background, so I'm familiar with using masks and HEPA air filtration and things like that. But for us to satisfy, like insurance for our businesses, we typically have to have a certificate that the mask was fitted by a nurse, so that we had proper coverage and filtration. And so I've paid attention to like particulate sizes, and I'm having a hard time finding the size of the actual COVID virus. It looks like it's anywhere from 0.08 to 0.14 microns. The science tells us the N95 mask doesn't filter that low. And I guarantee you a bandana or a loosely fitted surgical mask, isn't proper. So my question for you, with all that said, if we go to mandatory masks or that, how do we know that they're being worn right to properly protect the folks that are wearing them?
So the one thing that I will say to answer that is that the mandatory using of masks is not actually to protect the person wearing them. The places that are mandating it and us making it as a strong recommendation is to protect the people around you in case you have it and you just don't know that you have it. And so that's why I've done a couple of videos on making sure that the mask is actually snug around your face, because the idea is that if you can keep the germs closer to you, that instead of letting them out into the open, then other people would be less likely to breathe it in. Okay. And so that's kind of where we're at on that. And there's a lot of things that we still don't know about this virus. And it seems crazy, I know, because we feel like we've now been dealing with this forever. But there's still quite a lot of research that needs to be done about this virus. It's the same, with the micron size, they're just not really sure. They think it might be airborne, but they're not really sure. They think that it might be spread by asymptomatic spread, but they're not really sure. So it's kind of one of those where while it feels like we've been dealing with it forever, it takes a long time in the scientific community to actually get the answers that you really need. And so the mask wearing, they're kind of looking at different studies in different countries and different states where it's become mandatory and seeing what happens to the epidemiology of the virus in those areas. And what they found is that if they have across the board, everyone wearing masks and people are, you know, really, really doing social distancing. Oh, sorry, my camera's falling off.
Oh, shoot. I was enjoying the backdrop behind you. I don't have that
My
nice.
camera's just taped to the top of my computer, so it
Okay,
falls off
okay.
occasionally.
Okay.
So yeah, in those countries where they've really looked at the epidemiology, what they did find is that they did see a reduction in the amount of spread, and it is because they feel like it's keeping the germs closer to your own face so that it's not out in the air for other people to breathe.
Sure. Okay, good. And then, hey, I appreciate that. That's the best answer I've had. So,
Oh yeah.
excellent stuff. Good, good. That makes me feel like I better wear that more often. And I've been guilty, as referenced by Jennifer earlier in our council meeting, June 9th. I sent an email out to the whole entire council and asked their opinion and if they felt comfortable having an in-person meeting versus virtual. And in fact, Jennifer, that referenced this earlier, her statement was that I feel I mirror an earlier statement in spreading out our tables and providing ample space for those that attended. And she's right. There were people that said this is, they used expletives and four-letter words. And I'm sure you hear that at work, but we will take caution. We will pay attention. We followed the guidelines. We rent the community center for our meetings, and we followed the guidelines that they had set in place for their center and their building. And I believe that was submitted to you or to your office for approval. So yeah, we will pay attention and take caution with what we need to do going forward in the future.
Yeah, that's great. Yeah, and that would have been submitted to my environmental health team to review. Yeah.
Excellent. And other than that, yeah, so anybody wants to throw fiery darts, it's my decision to have that public meeting. So I take full responsibility of that.
And I will back him that he sent the email, and I fully support it. I think June was our best chance to have an in-person meeting, and so I think it was good that we took it. And yeah, everybody seemed to be like, June, this is the safe spot to do it, and so we did it and got it over with. But it looks like we have to be more careful now again.
Yeah, and I totally hear what you guys are saying, and I can tell you that so I made it mandatory that my team that had been working on this incident for a really long time take a week off at some point before the end of June. And so therefore I had to lead by example and take a week off. And I decided that I was going to do it at a time when we were not seeing any cases. And it was literally the last week before we started getting cases again that I took my week off. And it was for exactly that reason, because I knew, okay, we're coming to the end of the incubation period after we moved to phase 2 and travel ban was opened up. And so I fully expected that by the middle of June, we were going to start seeing cases again. So yeah, you guys took the good quiet time to have an in-person meeting, and now we're seeing cases again.
Yeah, we knew we had a narrow window there to get it done, and I think we had some stuff to discuss. It was nice to look each other in the eyes in person and take care of business. And then one other question, maybe for the commissioners. A lot of small business, I read Corey Stapleton's statement, 11,000 small businesses did not renew their business licenses this year across the state. 2 of those were from my personal businesses. So there's been a change at my house due to COVID. The financial relief from the payroll protection program through the federal government was a small help. But even though my business was deemed essential, other businesses I know are that do not exist. Is there, and I'm not looking for myself, but for others around me, what relief is available for other small businesses that are trying to stay in and trying to still exist? I took a different path, but there are some businesses that, taking out a second mortgage or selling some equipment off. I mean, is there, maybe that's for another meeting, but is there a quick answer, easy answer for that?
Well, Kevin, I could throw something out. This is Josh.
I like it.
Yeah, my family has a business as well, and we applied for some of the governor's COVID relief money.
Okay, good.
And it worked. And we have an agricultural business, and we qualified, and it worked. So
Awesome.
My understanding is that the state was given $1.25 billion, and the governor earmarked a chunk of that for private business. And said my understanding is not that much of it has been given away. And I think this is just my hunch. It's due to the capacity given. I mean, how many people they have working there can push these things through. So if you're interested, I found it really easily off the state's webpage, and it was a pretty easy thing to fill out. And then I ended up working one-on-one with a real person who was super helpful.
Awesome.
So I don't think they've given all the money away, and it wasn't that hard. So.
Good. I'll make that recommendation and tell them you send them.
Yeah, no problem. If it's an agricultural thing, I definitely give them a thumbs up. They were easy to work with.
The small icon at the bottom of my screen.
Yeah, exactly.
Exactly. And this is Dave. I will share in the chat function on here, the conversation function, the website URL for Missoula Economic Partnership, because they have a bunch of resources on their website for folks just like what you're describing.
Awesome.
So take a look at that, and I'm sure that the folks at Missoula Economic Partnership, I mean, this is what they do, and they would be glad to answer any questions that folks might have.
Okay, awesome. Thank you. Thank you for that answer. And that's all I have for my portion.
Great, thanks, Kevin. Tom Browder and Celia, do you have any questions?
Yeah, I just unmuted myself. I was a little late joining. We were having a lively HOA meeting about road paving up here in Sealy. But my one question would be, given that all of our campgrounds are full, people are dispersed camping any place they can find, do we have any results about cases either coming out of camping areas? Is there anything that as a community we might pay attention to up here?
Yeah, so I can answer that question, but it's not going to be a good answer. At this point, sorry, I just have to say that up front. It's probably not going to be a good answer. At this point, we have had a couple of out-of-state cases. We have not had any that were associated with a particular campground or even a particular geographical area. They just happened to be coming through Missoula and had symptoms, or they were staying somewhere in the county and had symptoms and went into one of our testing facilities, like Cost Care or Now Care or whatever. So we do get alerted when we have out-of-state cases. I'm working with DPHHS right now up at the state because we really want to know how many out-of-state cases are being tested in Montana. And so they have not so far been really, they have the information, but they haven't been tracking it as closely as they have Montana residents. And they haven't been sharing that with us. And so we're trying to work with them to figure out some way for us to be alerted to how many out-of-state cases test positive in our county, so that we can watch for things like clusters in different campgrounds, or a cluster in a hotel, or at a ranch, or something like that. So so it's definitely on our radar, and we've been trying to get that information, especially now that we're starting to see more and more people coming here. So hopefully we'll have more to share on that in the future.
Okay, just one related, semi-related. This seems to be the summer of the RV, because people can take their quarantined environment with them. It seems like, given that RVs live in kind of they've got some things that happen, like they go to dump stations, they take on water. Would there be any guidelines for them, that might be different from tent campers?
You know, not particularly. The way that the guidelines have come out for travel, which I actually did talk about this in my daily briefing today. If anybody is not familiar with the daily briefings, I think most people are at this point. They get posted every day at some point on my YouTube channel and also on Facebook, and they get sent out to the media, and the media picks it up. But basically, the CDC does have some guidelines for different types of travel. They don't have anything really specific to RV travel that's any different than traveling by car, except that, you know, to make sure that you're washing your hands frequently, try not to have to, you know, try to plan ahead so that you're not having to get supplies on a, you know, like every single day type of basis. But no, they haven't really come out with any great guidance.
Okay, thanks.
Yep.
Thanks.
Can I follow up on that tracing question real quick? I just was wondering, you mentioned about us tracking out-of-state tests that were positive here in Montana. And I know there's no real communication on a national state-to-state level, but we're right next door to Ravalli County, and they seem to be having their own sort of outbreak. How's the communication happening county to county in-state?
Yeah, so county to county, I have regular communication with our surrounding counties. I actually get Karen down in Ravalli County, and I email each other on a pretty regular basis. She actually, interestingly, because you brought up Ravalli County, Karen Johnston is the head of the public health there. She worked here in our health department until about a month before the pandemic. And so we have very close communication with her because she's new to this part of her job. And so, so we do work really closely with them. We also know that, you know, people come here from all over, you know, we're a hub for all of the counties as far as like a medical hub, shopping hub. You know, we have people coming in from other counties, you know, for all kinds of reasons. And so we do have very clear, regular communications. We were having daily calls with our surrounding counties, as well as some of our more specific people like Forest Service and, you know, Northwestern Energy and people that work regionally. And we'll probably go back to having those calls again. Right now, we've got them down to about twice a week. So yes, we are definitely having direct communication.
All right. So next we have Lee Bridges with East Missoula. Oh. Lee, are you still on? Looks like she just hung up. All right, that's it for community council members. Cindy, did you have any other thoughts that you wanted to share?
No, I would just encourage everyone to, you know, if you're on Facebook, definitely follow us on Facebook at the health department because we're constantly posting new information there. Our website is really good for different kinds of guidance and, you know, tune into the daily briefings. I cover a lot of different kinds of information. I try to put a description on what that is going to cover so that if it's something that you're like, I have no interest in this, then you're not wasting 10 minutes of your time listening to me ramble about it. But, you know, it's definitely a source of information. So if you haven't tuned into those, that might be a good place to look. And you can always reach out to us. We have a variety of different ways for you to get in contact with us. You can call 258-INFO. We've got people that can answer questions. From anything from how do I get a test to do I need to worry about getting COVID from my drinking water? I mean, they've gotten them all at this point, so they could probably answer it. And if they can't answer it, then they will take your information and get back to you. So yeah, just reach out to us. We've also got our online portal. So it's on our webpage where if you have a comment or feedback about how we're handling the situation, or you have a complaint about a specific business, you can always put your information in there and we can follow up on it. So don't ever hesitate to reach out to us here at the health department. I know it looks like we're busy, but we do have designated staff that's what they're there for, is to help answer questions.
Hello. Hello.
Hi, Lee.
I'm so sorry. I was muted. I hit the off button. I have questions. Hold on. Let me grab my notebook. I'll be right back. Cindy, thank you so much for this presentation. I definitely have questions. Sorry I'm the last person. I'm sorry I screwed up hitting the off key and have to get back on here.
No worries.
My first question is, you talked about testing. Thank you. I hope it's available. How long is it for the test results?
It depends on where you go for testing. So if you're having symptoms and you go to either one of our mobile clinics that we do through the health department or the fairgrounds drive-through clinic, then we have test results in 24 to 48 hours. If you go to a healthcare provider or a hospital or a walk-in clinic, then it really depends on what lab they use. So if they are sending it to the state health department lab, then it's 24 to 48 hours. But a lot of our clinics and hospitals contract with other labs like Mayo or Quest or LabCorp, and those results can take 7 to 10 days.
Okay, I'm asking this because I specifically know of somebody who is traveling from Missoula out of state and returning in 3 weeks. And I understand that the governor does not have that quarantined. I'm very concerned on a personal basis. That's why I want to know about the test results. I do hope masks are made mandatory. I want to say that East Missoula we don't have community council meetings over the summertime. We don't resume our meetings, our public meetings, until September. However, we have at this point had a lot of right on target issues that need to be taken care of right now. So we are using Zoom, and based on what I want to thank Jennifer from speaking earlier, who discussed having the public meetings that they have, and the fact that there's a lot of folks who show up and kind of diss the fact that we're trying to safely social distance and wear masks. For that very simple reason, I understand that the county commissioners are saying for us to wait till July. I'm saying that I don't have a crystal ball, and for September, for our first meeting, I am expecting to continue on until they have a vaccination and a cure for this pandemic. I am expecting to hold Zoom meetings, which is actually, there's a lot of pluses and a lot of minuses, but I'm starting to believe there's more pluses because a lot more people can attend who weren't able to in physical. Also, our community council, our community center is at the fire department, and they have it in place that we can't have more than 10 folks assembling at one time, which is great. I am all in support of the mandatory mask. And for an example, we have Habitat for Humanity, who is doing a lot of projects out here right now. They've asked me recently, as of today, they've asked me if I will submit a selfie. Will only submit a selfie with a mask on in this particular instance, and from here going forward until we have a cure for this pandemic. I want to thank Jennifer for pointing out and supporting my reasons for having these Zoom meetings. I guess that's all. Thank you so much for your time and your answer to my question. And I am in full support of mandatory masking at all times until this pandemic is under control. Thank you.
Great, thanks.
Thank you very much. It looks like Chet Krauser has his hand raised. Chet, do you have something?
Sorry, Sarah, I'm on my phone and I think I accidentally bumped it.
Okay. Cindy, I think that's all, unless you had anything else to say.
Nope, I don't think so. Everybody take care out there, and I'm going to jump off and run home and see if I can catch dinner with my children.
All right.
Have a good night.
Cindy, thank you so much for coming. It's really great of you to do this.
Yeah, no problem. And, you know, at any time, you guys are welcome to invite me back. I'm happy to come help answer questions. I mean, things are changing on a regular basis. And so, you know, the answers may be different the next time I come to a meeting like this. So invite me back if you feel like you need some answers.
Thank you so much.
All right.
Thanks, Cindy.
Okay, so next we'll hand it off to Shane Stack, Director of Public Works.
All right. Hello, everyone. Great job, Cindy. That was awesome. I learned a ton. I will try to be brief and get through this, and hopefully we'll have some Q&A, and then you guys can go have dinner as well. I'll start off with just our RSIDs, or our water and wastewater systems. So we have 4 of those. We have sewer and water in Lolo. Elmar, we've got a water system. Sunset West, we've got a water system, which is out towards the Y. And then Lewis and Clark and Clinton, we have a sewer and water system. With those 4 systems, we're actually going to hire an engineering firm and just put them on contract for the next 5 years to just provide engineering expertise in the form of sewer and water. So our first project with that firm is going to be actually continuing to work on the Lolo water system and water rights, and expanding the district in Lolo. So expect those types of things to be happening in the future. We've already worked with DNRC to get some additional water rights on one of the wells. Now we need to just expand the district. So Sunset West, the water system out there, we're going to be painting inside of the water tank starting Friday, and it should only take a few days, and we don't see really any impacts to the water system. They'll be able to just run on the pump, and the fact that the water tank will be down is not going to be an issue. Feel free to give us a call if you do have questions on that, though. Jerry, I'm guessing that's probably your area. Lewis and Clark, that's out in Clinton. We just upgraded their septic tanks. They had a really old self-sealed but somewhat leaking septic tank, and so we replaced that just this spring. I'm really happy we were able to do that really early on time and well under budget, so I was really ecstatic about that whole thing. And I think the folks out in the Clinton area are happy with that. So that's it for our water and sewer systems. Quick update on build. If you're following the build project out between essentially Reserve and the airport, we have 20% design plans complete for that project. We're currently in the process of hiring a contract manager, which essentially how we're going to build this project is through, it's called CMGC, contract manager, general contractor. So we hire a contractor to help us design the plans. They eventually then give us a guaranteed maximum price, and if that's within our estimates, then they get the work. If they don't, we have to negotiate price. But that's kind of where we're at. We're expecting work to begin next spring or next summer, somewhere in that ballpark. We ended up with $13 million in build funds. We asked for 23. And we did also submit this year for 2020 that additional 10 million. So we will be hearing on that request for funds here in the next few months as well. So that's kind of the status on build. Road and bridge. Really good news. Gas tax passed. So thank you for the passing of that. That will help us do quite a bit of work that we were probably not going to be able to do in the next few years. And I'll tell you that it's not only Missoula County, but it's the city of Missoula that's benefiting from that too. So we're estimating that we'll generate around $500,000 a year for the county, as well as $500,000 a year for the city. So that's a pretty big shot in the arm. I guess to give you perspective, on our road budget, we sit around $5 million. So that's a 10% increase for us in revenue. So that's kind of a big deal. Next kind of big thing for road and bridge is we're scheduled to have a pavement management system starting up this July, which the great thing about that is we've got 250 miles of paved roads, but it's hard to really look at that and say, all right, how much money should we be spending on that system? Secondly, what should the treatment be for those systems as well? So we'll get an idea of what the treatment should be and how much it's going to cost. I think we're going to be a little shocked at how much money we should be spending on our paved systems, but at least we'll know, and we can start working on the planning on how can we get the revenues necessary to take care of those roads. Right now we're doing dust abatement, so if you have gravel roads in your area, more than likely it's probably going to get some treatment. So we've got 48 miles of the 200 miles of gravel roads in the county are getting dust abatement this week and next week. We should be up in Sealy next week. Right now, we're kind of down in the Missoula area. 3 bridge projects to give you updates on. Main Street in Frenchtown started June 2nd, so that's a complete bridge replacement, kind of right next to the elementary middle school. And that should be done August 14th, and that's a good thing in case the schools are actually open this fall. People will actually be able to get to the school. Bible Lane, that's out in the Alberton area. We've got a bridge that we're going to replace. We're expecting July 13th to start on that. It's a 75 calendar day project, so that'll be work done well into the fall. And then finally, Lindbergh Lake. If you're out in the Swan, there's a bridge that's just right near the lake there. So a little bit of kind of just, I'll call it maintenance work. We've got L&J Construction has been hired to do that. We're still working on finalizing their contract. We assume that work should be starting at least by August. Some road work in the Swan. Highway 83, MDT is going to do a milling project. It's around 14 miles long. They're going to mill up 14 miles of the road and then fill that back in with new pavement. The benefit to the county is we're going to get those millings. We're going to place those on 3 to 4 different roads. We will place the millings on Frontier and Canyon and Sealy, Placid Creek Road, kind of south of Sealy, and then Holland Lake Road will get millings as well. All 3 of those projects, or 4 of those roads, we will incorporate with the millings it's called a rejuvenant, and so you mix that in with the millings, compact it, and it's very similar to a pavement, and then we'll chip seal over the top of that this summer. We've did quite a bit of research. We went up to the Flathead and talked to them. This is something that they've been doing for years now. They've kind of got it down to a science. So we really worked with them pretty closely on what they were doing so that our first crack at it, we're going to be successful. So I'm pretty happy about that. And really the great thing is we're recycling that material that may have otherwise just been put into a stockpile. Some other little projects, if you're familiar with the Y area, there are 4 approaches kind of on the west side of Highway 10, and they seem to always be dragging in gravel onto the Highway 10, and so those 4 roads are Derby Drive, Summit, Inspiration, and Futurity. We're going to pave all 4 of those approaches back so that there's no longer going to be gravel coming on, and it's actually a little bit safer for us to be grading those roads. Some residential streets we're going to be paving this summer in Miller Creek area. Stonehaven Terrace and Lorraine will be doing some ditching and then paving. That's probably going to be August work. And then Rattlesnake, Patty Canyon, we're going to try to get those prepped this year for paving next year. That means essentially some ditching, tree removal, improve the drainage, and get it ready for paving. Incidentally, if you are interested in that project due to any potential tree removal, get a hold of me. We're going to try to meet as many folks on site on both those locations as possible to talk about trees. Working with Parks, Trails, Open Lands, and our CAPS folks. We are planning to fog seal the Piltsville Trail this summer if we get enough time. So that trail along Highway 10, we'll get that fog sealed and get some longevity on that. So I don't know, Bert, maybe you're happy about that. And then let's see, there's an MDT contractor that's going to be doing work on the interstate east of town, and we haven't got a commitment for the millings on that job, but there may be potential that we'll get 20 to 40,000 cubic yards on that, and that would get us another 5 to 10 miles of roads that we'd get to millings on, and all that work would be kind of towards the east end, call it Bonner, Clinton, Rock Creek. No guarantees, like I said. Most of those millings are supposed to go to Granite County, but we're not certain, and the contractor's not certain that Granite County is going to be able to use them all. So that's the update on road and bridge. we'll jump into the building department. Our main office for permits, we are open Monday through Friday, 7 a.m. to 3 p.m. The Sealy office has hours starting the week of July 6th on Tuesday and Thursday from 10 to 2, as long as appointments are available. So if those times don't work for you, get a hold of us and we can set up appointments for some different times. Inspections, they're kind of doing inspections as normal. Definitely wearing the proper PPE though as they go out and do inspections. Last thing as far as an update and kind of the major thing is we are going to increase the fees for electrical, plumbing, mechanical, building permit. And that happens July 1st. We were originally going to do that July 1st. And I would say the commissioners made a decision to change that to July 1st to provide some, I would say, relief to our contractors and home builders out there to not hit them at the worst possible time. And then just comparison on the building permits. Last year from January to the end of June, and so we're not quite to the end of June, we had 1,149 permits, whether it was building, plumbing, electrical, and mechanical. They're all kind of in that aggregated number. This year, and we haven't made to the end of the year though, but we are at 1,022 and we still have, almost a week left to go. So we may get close to, as fast as things are going out at Public Works right now, we're pushing out a lot of building and plumbing and electrical mechanical permits. So even with this COVID crisis, we still see a lot of people working. So that is all I have for an update. So I'll let Sarah do her thing on Q&A.
Thanks, Shane. Bert, do you have any questions?
I've got one. Shane, on the road between Bonner and Clinton, frontage road, what is it, 10 or 210 or whatever it has to be called on Monday or Tuesday? Who's responsible for striping that road?
That's an MDT route. It's secondary highway 210.
Okay, because whoever did the center line striping between mile marker 2 and 3 were either texting or drinking, one or the other. So
when did they stripe it, Bert? Was that really recent?
Yeah, it's been about a month.
Okay.
Maybe a little more.
Okay.
I'll reach out to MDT. I wasn't sure, and it just came up last night when I knew we were going to have this meeting. So thanks. That's all I got.
Okay.
Thanks, Bert. Kevin, Jackson, and Lolo, do you have anything?
Yeah, I got a couple things. Shane, first off, RSID 901, obviously Jason does a great job. He's got everything up to date for years, and we seem to be ahead of the curve out here. So we look forward to hearing whatever is going to happen in the future, but we're happy the way it's gone. On roads, I do not envy how you're trying to deal with this much roads with that kind of budget, but and for that reason, I never try and give you, potholes or things like that. But we do have a couple things that have come up here recently. Kevin might know more. We have a road sign here, the school road sign that does the flip. It's not flipping on the northbound lane. And we also always perennially have some drainage issues on Ridgeway. I want to know if there were any projects to deal with those, or if you had scheduled for either of those.
So let's talk Ridgeway first. I think, we were up in that Lolo area doing some ditching earlier. I can find out. I don't think we have anything right now scheduled for Ridgeway, but if you give me specific locations, and the other thing I'll tell you is don't ever be afraid to let us know where the potholes are, because we've got a couple crews that go out and have to deal with potholes, and it's just, if we know where they're at, it's easier to get to them. So always just let us know. And then on Ridgeway, if you can let me know specifically where at, I can ask. I know there's kind of, I think you said it's more of a perennial issue, and I'm pretty certain it's probably an area that we're very familiar with. I'm sure I know where you're talking about, but if you let me know, I don't mind having them go take a peek at it.
Yeah, it seems to be one of those problems. It's moved back and forth between a couple addresses over the years, you know, and something will happen, the ground will shift, and then once again we have some puddling up there, and that becomes a problem in the winter when there's ice.
Yeah.
And like I said, Kevin obviously would know more. He's getting more of those calls than I am these days.
Yeah.
There was, there's been some discussion about, and again, your budget is tiny, but again, finding grants or some way to fund the flashing yellow light in front of the fire station here, in front of the rural fire district. And I just want to know if you knew any place where we should be looking to try and find something like that, you know, so that we can try and come up with those funds.
Okay. Yeah, we can certainly look into that. It's interesting, like Sealy, I know they want to get speed feedback signs too, and try to fund those. And I know they're actually looking to just put an RSID together to fund those. So maybe that's a solution, is kind of a community-wide RSID, which frankly you would not have to pay a whole heck of a lot. But one thing you could do is expand that into more of an RSID that would cover the roads in Lolo. And then you'd have a little bit more money to do work on the roads in Lolo, and it would be dedicated to that. So that might be a solution. And then back to the speed limit sign on US 93. I know Glenn Cameron at MDT is working on that, and Kevin does a good job of reminding both Glenn and I about that issue. It is an MDT route, and it's an MDT sign, so it's their responsibility to do it. But I do know that they are working on it, and yeah. And like I said, Kevin is pretty regularly reminding both of us about that. So
I'm sure. Thanks.
Hey Shane, I might just add to that question. I know our grant staff have continually been watching for a potential grant source for the fire station light and sign situation, and have just really not had much luck. Just wanted to let them know we have been watching and looking.
Awesome. Thanks, Chet.
Shane, this is Josh. I just wanted to throw something out and say this to Kevin and to the other Lolo folks, that Shane and John Hart and a few other of our key staff put together kind of an RSID 101. So for your community council, if you were interested even in like what would it take to create an RSID that would dedicate some money just for the roads in Lolo and take care of this flashing light, you could get that info from Shane, and you could work through it, and you could make it happen, and that would be a funding source. And as Shane pointed out, you would barely notice it because it's spread out among so many people. So, and we streamlined this process to a certain degree if you're interested. So.
That's good. We did have a council member that was talking about looking into RSID for traffic and I think pedestrian safety. So I'm sure I'll try and get his email address or get your email address to him. But thanks.
Yeah, you could make all this stuff happen. It would really be a lot under your own control, which might be pretty appealing.
Yep.
Thanks, Devin. Doug Anderson and Sealy, do you have anything?
I do not. That was very informative again. Thank you.
Jennifer and Lolo, do you have any additional questions?
I think I'm good. These guys got it. Thanks.
Yeah. How about you, Jerry in West Valley?
Yeah, Shane and I are working on some things out here that we're just muddling through. And I just want to say thank you, Shane, so much for your transparency and always willingness to help and answer questions, and really, really appreciate the leadership that you bring to the position. It's a breath of fresh air.
Thanks, Jerry.
Callie and Bonner, Milltown.
Yeah, I have a question, and it might not be something you can answer, Shane. There is some highway work being done on Highway 200 around Marshall Creek. And obviously that's MDT area and they're doing the project work. But I also know that the county recently sought public comment for the like Highway 200 visioning and redevelopment plan. And there was a lot of interest for a bike path to continue from where it ends right now in the Bonner area and continue through to Missoula. And I was just wondering if you know anything about the communication between the county and MDT, and if there's any sort of coordination that's being done to ensure that MDT is doing work in a way that will either support future work on that section of the highway or at least won't prevent future projects from happening because we just spent a bunch of money on this area of the highway.
No, very good question. So, oh gosh, probably 4 years ago, MDT did place a short retaining wall because there was erosion at the top that was kind of eroding back into the roadway. And probably a year after that was completed, the river, we had pretty high flows and the river actually started eroding the bank. And in order to protect the road, they're going to have to build a new retaining wall and a larger retaining wall. So when I was working for MDT, I certainly advocated at that time that they needed to build it in such a way that it would not preclude a path. And what's interesting is even just by saying we want to do it in a way that doesn't preclude a path, it's almost like saying we want you to build a path with this project. And that's not really what we were asking for, but certainly you certainly gain less interest with folks in that project when you start talking about it. But I had a really good conversation with the folks at Federal Highways, and that project is being funded through an emergency program because the damage was done like through flooding, and so they get some emergency relief funds. And Federal Highways really got the idea of if you build it a certain way, and do it in a way that doesn't preclude a path in the future, that's great. But their concern is, and they're following the rules, is that if we do that right now, you can't build a path through there. And if you do it in such a way that allows a path to be built, it's a betterment. And we can't have a betterment with an emergency project. And so the great thing about the cameras is I can see the look on your face, and I feel the look on your face. It's really as frustrating to me as it is to you. So, and then to your comment on communication, yeah, MDT has communicated directly with the county. I've actually had a handful of conversations with them about it and let them know that we want you to do it in a way that allows for a path in the future. And I can tell you the local folks are looking at it and saying, can we do that? But it's been let, right? So it's under construction, and it's hard to make that change now. For me, the good news is looking at it, the way they're building it, you're probably still going to potentially have to build a smaller retaining wall on the bottom. But at least there's quite a bit of fill that's going in below the retaining wall that they're putting in today, which, if in the future there's a funding to build a path there, at least we could, do it through a retaining wall. The other option is just kind of bridge a short distance, and they're still going to have from the fog line out, you're still going to have quite a bit of room on most of that. Most of it, you have a lot of room. There's a short segment that's just so pinched that you can't really fit much in. And if they really, I'm a little frustrated. I wish they would have just focused a little bit more effort on that location, pulled that wall out there and made the room, but it didn't happen that way. So,
hey, Callie, this is Dave. Shane is a little more charitable than I am in the mood for tonight. And yeah, it's been extremely frustrating over the past few years. And I feel like the commission has pressed pretty hard with MDT, even having conversations with the director of MDT about this. And as Shane articulated, we got what we got here. And I certainly hope that and I have made this comment throughout the Highway 200 corridor study, that the Marshall grade portion of the roadway be accounted for and be looked at as part of that study. And I'm optimistic and hopeful that that will be the case. So regardless of what MDT does or does not do as part of this project, I'm still convinced that we've got to figure out a path forward there at that constricted portion of highway.
Thanks for your candor, both of you. I really appreciate it. It seems so wasteful to spend, let's see, $4.6 million on a 0.2 mile section of the highway that we want to fix and make different.
Yeah.
Yeah.
Did you have any other questions, Kelly?
Nope, that's it. Thank you.
You're welcome. Kevin and Lolo, do you have anything?
Hey, yeah, to the folks in Sealy Lake, looking to get some speed feedback signs. We've got one you can have. It's a mechanic special, but we'll let you take that off our hands. It doesn't work very good. Hey, question to Shane. We have a couple homeowners associations that are asking about some new potholes that are popping up. Should I have the president of the HOA call you, or is that something you want me to? How's the easiest way to get that done?
Yeah, it doesn't matter, Kevin. You can have them get a hold of me directly, or you can be the conduit. I don't really have a preference. I will just want to make sure that it's a county road.
Yeah, okay. I hope it is. You plow it, so.
Okay, all right.
Yeah, the one in front of my driveway, your plow caused something. Just kidding. That's another discussion. Just kidding. And then the other question you mentioned earlier about like sewer water expansion in Lolo, and maybe for another meeting as well. How do we gain information? I like to keep an eye on that and just know what's coming.
Yeah, so that would be great. And one of the things we talked about, earlier, I think it was this winter, we met with the community council and gave you guys an update. And one of the things we talked about is giving you a tour. And I don't know, we've actually talked about it internally. If you guys want a couple of you to still maybe go do a tour, I think we can make that happen. And we can, at that point too, explain kind of that expansion. So
okay.
And I'll just give you the short answer though. So there are houses and users outside the actual district boundary. So we've got to get that district boundary to be out further than the folks that are there. But then they're still paying for it. But we've got to expand that district, and you really have to focus on that too. As Lolo grows, there's more and more people that are going to be using that system. So just focused on making sure that we have the systems necessary to take on the growth of that area. The water rights thing was really great. We've been able to complete that with the DNRC, and we think we've got the capacity for the next 50 years for that community just with that one well. So
awesome.
It's just visioning to the future and making sure that we're prepared for the growth that's going to happen.
Awesome, thank you. And I'll find out from the council who wants a tour, and then we'll get a hold of you, or maybe Deb Bell. Is that the right one?
Yeah, you can talk to definitely me, Deb, or even Jason.
Okay.
I actually kind of want to go. I enjoy that stuff too, so I learn a lot.
We'll communicate shortly in the near future on that.
Okay.
That's all I got. Thank you.
Thanks, Kevin.
Thanks for your hard work for us out here.
Thanks, Kevin.
You're welcome.
All right, to wrap things up, Tom up in Sealy, do you have anything?
Just one quick question. The milling project on 83 North, which milepost will that be between?
It's basically from the county line south, and it goes from 31.5 to like 45 and change, plus or minus.
Great, that's what I wanted to hear because it needs it. Thanks.
Yeah.
That's great.
Did anybody have anything that we missed? No?
I just, Shane, this is Jerry. I forgot one thing. Was it, did you guys just finish paving a stretch in front of Erskine turnoff?
Yeah.
Okay. Are you doing any more approaches like that out here?
Oh, I thought Jerry email me because I thought we had a couple more that we were going to do when we were out there. And I don't know if they decided not to do them and just focus on Erskine. But at one point, I thought we had 2 or 3 others that we were going to do when we did the Erskine one. So email me and I'll double check.
Okay.
And then can I ask you a question?
Yeah.
Did you go look at the mowing?
Yeah, I did.
So did they? Okay, I was going to ask, did they get the whole path?
Oh,
No.
heavens no.
Okay.
No,
All right.
no, it's pretty bad.
Okay. I had one of the grader operators talking to me this morning, and he said, yeah, I drove by and there was a guy on a tractor out there mowing the grass. So anyway.
No, he must have had a lunch break that extended, but no.
Okay.
All right. Shane or the commissioners, do you have anything else to add? Or any other staff?
I'm just so grateful for Shane and Cindy and staff for hanging in there, and again for all community council meeting is yeah, I love it. Thank you for taking the time.
Yeah, absolutely.
That.
Our folks continuing to find this useful, and would it be worthwhile scheduling another one in the next month to come?
I was going to ask if we were going to make this a regular monthly thing.
I think it's kind of up to you guys. We'd be happy to if you want to.
I think this is Jerry. I really appreciate the information, and I know it's so hard for you guys to get to our meetings with all the other meetings that you have, that I think the communication is really nice, and I really think these are beneficial, and it's nice to hear some of the other councils and what they're doing and facing as well. And I think that's just the whole purpose of community councils, is just to be that cohesive unit and speak for the for our constituents. So I think it's great.
This is Cal, and I just want to echo that sentiment.
This is Jennifer. I agree. And can we please just put Cindy back on next month as well? That's super helpful.
Sure.
Agreed.
We can do that.
Yeah, these next months will be really interesting with those numbers. And so, I agree. It would be great to hear from Cindy in a month.
Yeah, second, third, fourth, and fifth that from all the good folks out here in Lolo.
Yeah.
Get it done.
Absolutely. Second, all those motions. Look forward to it.
Thank you for that, Missoula. I really enjoyed these Zoom meetings that we're having now that I'm learning how to do it.
Thanks, Lee. And I guess if there are specific topics that folks would like other staff to come in and speak to, we can arrange that also, in addition to Cindy.
It is, as Jerry said, if you all are having your own meetings where you want one or all of us, just invite us, and we'll do what we can.
Okay.
We won't know unless you let us know, though.
Does this time work well for everyone?
Yes.
Yeah.
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 Okay.
Yes.
Yep. Good here.
Well, go eat dinner, everyone.
Yeah, go eat. Take the rest of the night off.
Thanks, Josh.
You bet.
Thanks, everyone.
Thank you.
Sarah.
Good to see all of you.
Bye-bye.
Bye.